Well, they change my dressings on my ulcered leg. They dress it, they attend to it and see what's got better and so on,
It's better for the patients and their family because they feel like they can talk to us, whereas sometimes when you're rushing from one patient to the other, they want to ask you stuff and they say, oh no, you're busy, I'll let you go, don't worry. Whereas now they know we've got the time to spend with them, so they can tell us all the things that are worrying them, or if they just want to have a chat, then we can stop and have a chat with them because they know we're not rushing out the door. They don't feel like they're keeping us from anything. We've had a lot of feedback from our patients saying how much they like this way, because also part of the Buurtzorg way is that you have a named nurse, so our patients get to see the same nurse, which means they build up that rapport with them and it builds a therapeutic relationship, where if we're trying to get a patient to self-manage, we're building that relationship up with them first so we can find out what their worries are and what they're capable of, what they want to do, and we can work with them at their pace and their time to get them to self-care. Whereas if we was rushing in and out, we haven't got the time to do that.
Well, it's more personal now, definitely. Tina's more aware of, it's because it's her patient or her client, whatever you want to say. At least she can see the progress, she can see the deterioration. Before, we would just get someone that we hadn't seen for 6 months or 5 months or 3 weeks. They didn't know what to expect. They didn't know if there was improvement. Now it's definitely better. Definitely better. There's no question about that.
We're seeing better outcomes with our patients. We're seeing patients, if they've got wounds, we're seeing them heal quicker because we're being able to put in the right treatment plan early. If we had someone with a leg ulcer in the community and you need to do a Doppler and an hour's assessment, you didn't always have the time, so you'd have to delay that. Whereas now we're getting to do it on the first visit, so we're getting the most appropriate treatment in early, which means they're healing quicker, and with assisting patients to self-care as well. So that's nice to see the patients being able to take ownership of their health again.
Improvement in Pat's leg, well, huge. It's a huge difference. I mean, they're completely, well, when I say completely, 95% healed now. We've been battling with them for about 2 years. And I really believe it's because she's watched it and changed dressings and done what's required, which you don't know when you only come here once every 6 weeks. Because she now knows our routine, she knows exactly what's going on here. It's definitely more personal and definitely better. It's definitely better.
She's very flexible. She fills in with my carer and I. If we ask for her to come on a certain time or change the times, always very reasonable about changing things and very adaptable. It's nice to see the same person each time. You can see how it's progressed and tell me likewise what is going on. Whereas before, if you have someone different each time over a week, 3 days, possibly you don't get that effect.
Whereas now you can get hold of Tina, speak to Tina. She knows what you're talking about. You don't have to explain. You don't have to go into 2 years' history. There's somebody there. It's direct contact. It's support for me. If I've got a problem, I can phone her. It's a great help. It's more than a great help. Yes, I actually phoned her last week because Pat had a swelling on her leg and she'd been on a course of antibiotics and I didn't know whether it was necessary to call a doctor or not, and I phoned Tina for advice and she answered my question.
It's continuity of care. The care plan that's put in place is then continuous. You haven't got different nurses coming in, giving different advice, changing the plan of care all the time, which has been seen to delay wound healing. And because they've got that person coming in and the care is the same all the time, they notice when things aren't the same or when they need a change. And we've seen quicker healing times of wounds, especially leg ulcers, and the patient is then given the appropriate care, effective care, and it's quick and they're quick to discharge then.
We're now based in a GP surgery, so we're working a lot close with our GPs. We found the communication has improved with the GPs and it's sped up the way we work with our patients. So for instance, in community before, if we needed some medication, then we would have to send an email to the GP, which would be picked up by the receptionist, then sent to the GP, back to the receptionist, back to the community admin, then come to us, which is quite long-winded. So now we just literally go straight to the GP's door, knock on the door, tell them what we need, and they solve the problem there and then we get straight back to our patient. So it's better for the patient. and better for us.
I'm very happy with the team, and they really are nice to work with, and that makes a huge difference to my job, to Pat's life, to everybody's. So now I've enjoyed working with them, and it's been a definite improvement. I think it's a system that should carry on.